All right, so we're looking at subacromial impingement. We've got the two types of impingement, subacromial, and then you have the posterior impingement, different video for posterior impingement. But with the subacromial impingement, the idea is you're pinching some soft tissue of some sort, muscle, bursa, whatever, underneath the acromion, or the acromio, or the coracoacromial ligament, or potentially the coracoid itself. So this little arch is where we're thinking something's getting pinched with certain activities. So your two primary tests that are more sensitive tests, so they're good at ruling out, are going to be the Hawkins-Kennedy and the Neer's test. So if we look at Hawkins-Kennedy, the idea is that I'm going to bring this person's arm up. Now, elbow flexed, we're going to be slightly internally rotated, and from here, if I bring him into a more abducted position, I start to rotate that arm while I'm driving this up. I'm taking the musculature here on the backside of the shoulder and I'm just driving it. The capsule itself is going to tighten up and everything's going to end up getting compression across that acromial bottom, the coracoacromial ligament, and then the coracoid itself. So I'm driving that there. Now, if we look from a impingement standpoint, the tissue that would be most in the way or potentially between the humeral head and that kind of ridge that's created between those two bones and that ligament to structure is going to be supraspinatus, potentially a little bit of infraspinatus, but mostly the supraspinatus. Now, the other version of this test is where the person is more in this position. If I rotate him just slightly, the idea for this one is that you're now getting the biceps groove here. That's come across. And then when you internally rotate, you're taking that biceps tendon, and that's what's being driven into the coracoacromial ligament, the coracoid potentially. So out here, you're looking more at the musculature at that greater tubercle. Over here, you're getting more of that biceps tendon. So that is going to be your Hawkins-Kennedy test. The Neer's test is they're going to start here. You're going to internally rotate them, which brings the soft tissue on this side of the bone, so the greater tubercle, and you're going to now take that and just drive it up, and that will end up approximating the person's humeral head towards that arch that I mentioned earlier. Now, if they have a fair amount of flexibility with the scapula, you may need to come on that side and kind of hold it down as they come up. Proper way to do that is to come around the top and just hold this down at the acromion, internally rotate, and then drive them up. And if you do that, it's more of a solid stop. If you don't block that, they'll have a greater range that they get to, and depending on the irritability, if it's lower irritability, you actually might get a false negative test on that. So low irritability, moderate irritability, I definitely would recommend you hold this down for the test. If they are high irritability, there's a chance that you get halfway through their range and they are going to feel pain just because everything is so sensitized due to primary and secondary hyperalgesia. So, all right, so that is how your two tests for the subacromial impingement work. I've got another video for posterior impingement, and then I also give you one for full can and empty can as well. Not diving into any other ones just because it gets a little harder to visualize with this guy since he has no muscles attached to him. Not your fault, buddy. See ya.